I'm Jennifer Smith.
And I'm Melva Jones.
And we are Women's Health in Black and White. We covered bacterial vaginosis, recurrent infections in a previous video, and today we're going to talk about recurrent yeast infections.
Right, and this was I was about to say not patient, but this was a viewer request. So we wanted to make sure that we covered this. And if you guys have anything else, please continue to send those and we'll tackle those topics too.
Yep, we want to put out what you guys want to watch.
Mm-hmm.
So, yeast is very common. It's in the environment all the time. It's just a little microorganism. And it is beneficial for many things.
Mm-hmm.
If you ever had a really good loaf of bread, you've enjoyed yeast.
Donuts.
Donuts.
Donuts, yeah. But there are some species of yeast that can cause infection. Now the trick is which species is causing your infection, and that's one of the problems that we get with a lot of recurrent yeast infections. So yeast is actually in our GI tract, and we can be asymptomatically colonized with it at any given time. We also can have a genetic predisposition.
Mm-hmm.
If your mother was sensitive and got a lot of yeast infections, chances are you will too. For many women, there's really no clear trigger. They can't pinpoint this is what I did that caused it. They just all of a sudden start getting itchy. Mm-hmm. But a lot of women do notice that things happen that they can be predicted.
Right.
So if you go away for the weekend, have a whole bunch of sex.
Mm-hmm.
If you sit around in a wet bathing suit for a long time. Getting to a hot tub can do it for some women.
Right.
Being on antibiotics, that's the big one for me.
Yeah, that's a big one.
Yep. If you even suggest that I might need an antibiotic, I will probably get a yeast infection.
Yeah.
Periods, right around your period, either right before or right after. A lot of women can get signs and symptoms of yeast infection. These things aren't something that you're doing wrong. I mean, you're just living your life, but they can trigger a yeast infection. The diagnosis for yeast infection, the gold standard is what we call a wet prep. The gold standard is a culture, but they're expensive. So what people usually do is a wet prep. They take a sample of discharge, they put it on a slide, and they go look at it under the microscope. Yeast makes a very characteristic budding, looks like a branch of a tree with little buds on it, pattern. That only has about a 40 to 70% sensitivity. So depending on who's looking at your slide and how much yeast they can see in that particular sample, they may not be able to diagnose what you have going on. My practice, I use a culture every time. Now, I will treat based on symptoms, especially for somebody who's absolutely miserable. And frequently when I get the culture results back, I was right.
Yeah.
Every once in a while I was wrong, but usually I can guess based on symptoms. There's one other test that's a DNA probe, and when you have recurrent yeast and we're worried that we're not getting the right species of yeast when we're treating, then we need to do the DNA probe. That's pretty expensive though. Most women have had a yeast infection. If you get to your 50s, probably at some point you've had a yeast infection.
Yeah.
We call those sporadic vaginal candidiasis infections. But there are a few women, something like 10%, who get recurrent yeast infections. That means it happens very, very frequently, but 10% of the population of the United States is still 372 million people. And that means that these women are not having intercourse. They're not comfortable.
Right.
They're not focused in meetings at work because all they're thinking about is how much they itch.
Yeah, it really does affect their life.
Yes, they're missing work to go see the doctor, or they're self-diagnosing and self-treating with over-the-counter medications, which may or may not be treating their problem effectively. You are far more likely to get recurrent yeast infections if you take frequent antibiotics. If you are on contraceptive, if you are using contraceptive jellies or creams. If you have an immunodeficiency problem, and that could be anything from you've had leukemia to a transplant to HIV infection. There's a whole bunch of different things that can cause your immune system not to work correctly. Women who have mechanical irritation. So all you guys are wearing the really tight jeans, you're doing that to yourself, sweetie.
Right. Mechanical irritation.
Mechanical irritation.
Okay.
So tight jeans, tight workout clothes, especially wearing those workout clothes for too long after you've worked out. Frequent intercourse can do it. Some people claim that it's sexually transmitted. There might be a sexually transmitted component to it.
Right.
And I do find that women who have frequent sex get them more often, but I think that's just introducing the yeast into the vagina.
Yeah.
What I have seen, though, is if your partner is uncircumcised, he can get yeast underneath the foreskin, and that can be transferred back and forth.
Right.
We have to treat both partners in that case. And women who have diabetes are much, much more susceptible to yeast infections. So, one of the ways that we can treat recurrent yeast infections is that we ask you to stop self-treating. I know it's so easy to run to Walmart and pick up that monostat, but if you're getting more than 4 to 6 yeast infections in a year, you're not getting clear of the problem. The monostat is making it subclinical, so it takes away some of the symptoms, but it doesn't fix the problem, which is why it comes right back. So if you will stop self-treating, let us figure out exactly what we need to treat, and then we will try to pick the best medication option. We do have several. Yeah. There are creams, and there's the pill, the diflucan. Everybody seems to want diflucan, and I get it. It's easy to take a pill.
Yeah.
It's easy to take a pill. I get it. But I like instant gratification, and that pill's not going to kick in for 2 to 3 days.
Right.
I want to feel better tonight. I usually opt for the cream. The cream is messy. There are 1-day treatments, but that is a high dose of medication, and especially my pregnant patients, that's too much. Yeah. They wind up getting way more irritated than they would if I'd left them alone.
It causes a lot of irritation.
Yes. There's 3-day treatments, and there's 7-day treatments. Yeah. And especially in pregnancy, sometimes we have to double down and do a 14-day treatment to clear it all. Yeah. But once we get you clear, if we can keep your pH balanced and keep some airflow around the vagina, we can hopefully prevent you from getting it again. Now, when you've had that 4th or 5th yeast infection during a year, I would absolutely get my hemoglobin A1C checked. I want to know if I'm a diabetic. Yeah. I would absolutely ask to have the culture done and see what we're treating so I can get it right. And then the lifestyle changes like looser clothes, cotton crotch underpants, not sitting around in sweaty gym clothes. Yeah. Keeping airflow, basically. Also a probiotic, a good one on the market is called Culturel GG. It's basically the equivalent of eating a gallon of yogurt in 1 pill. You can also go to the pharmacist and request something called Acidophilus lactobacillus. It is a pill form of that good bacteria that eats yeast. He'll have it behind the counter in the pharmacy, but it's not prescription. You do want to keep it in the refrigerator. It's an active bacteria, and if you'll keep it in the refrigerator, it'll last longer. And that can help put good bacteria back into your body so that you don't wind up with another yeast infection really quickly. That's about all I've got for yeast.
Yeah, only thing I will add, like when Jennifer mentioned about self-treating with over-the-counter stuff, also, the nurses and people tell us weird things. Do not try to scoop the yeast out yourself. That is not an effective treatment. If anything, you're probably pushing it back up further in your vaginal canal, or even whatever you're getting out, like that's not treating your yeast infection. Like you can't scoop it out yourself.
That doesn't cure it.
It doesn't cure it. I have heard, some people think if they just eat yogurt, but it's not enough to.
It's not.
It's not going to be like the probiotics that she said that you can take orally.
Plus, it's a lot of sugar.
It is, and that could, especially if you're diabetic or if you're struggling with like insulin resistance, that's just going to amp it up. Yeah. And then the other thing I was going to say, I forgot. I have heard some people have asked me about putting yogurt on a tampon and using that like a suppository. And I'm not going to say that it doesn't help, like it soothes, but that's not going to completely like cure you.
Plus, you have to get yogurt with live cultures. You've got to read your labels. And yogurt that's unsweetened. You don't want to be putting sugar up there. That's just feeding the yeast.
Yeah, that's feeding it.
But it is, like if you have a really bad yeast infection and you're just dying and it's midnight
Mm-hmm.
and you're not going to be able to get
Yeah,
a doctor,
right.
you don't want to go to the ER for yeast,
Yeah.
you can run to Walmart and see if you can find an unsweetened,
Some plain,
live
yeah.
culture, plain yogurt that you can just use topically. I wouldn't necessarily push it while up in there,
I know.
but putting
I
it
wouldn't
topically
like it.
will be
Yeah.
soothing and it'll
Right.
get you through the night until we can get you treated.
Mhm.
I will say, I didn't address this and I'm so sorry. Yeast doesn't usually have odor. So if
Right.
you've got a really foul or fishy odor, you probably don't have yeast. The discharge is white to sort of a gray color. And it gets described as cottage cheese, but it doesn't look like that to me. It looks like ricotta. So
Yeah.
I'm sorry if I just ruined your lasagna, but it looks like ricotta.
It does look more ricotta.
And the main symptom is intense itching.
Itching.
Like
Mhm.
you can't sit still. from
Right.
Itching.
It's very uncomfortable.
Very uncomfortable. And you know, I think people just kind of go, well, it's just a yeast infection.
Mhm.
I don't know what your problem is, but this is costing us billions
Yeah.
in lost productivity, lost wages at work,
Right.
missed work, paying doctor co-pays.
Yeah.
I mean, this is a big
It
deal.
is a big deal.
And just because it's just a yeast infection doesn't mean that it needs to get brushed under the rug
Treated
and we need to
lightly.
pretend that it's not a
Right.
problem. For a lot of women, this is a really serious
Mhm.
problem and can affect every aspect of their lives.
Yeah.
We can give you back much better quality of life if we can keep you from getting these recurrent yeast
Right.
infections. So it is a big deal.
It is a big deal.
Please call us if you get one. Please tell us that if you've gotten more than 4 in a year. Please don't suffer in silence. We can help you. So give us a chance to do that.
Yeah.
This came directly from a viewer, and we are very interested in doing that. If you have questions, if you want us to cover a topic, please let us know. Tell us on Facebook.
Our Instagram, our Twitter pages. Also check us out on our podcast Afterglow, where we cover topics that we've talked about on air. And like, subscribe, and send us any other feedback that you guys might have for us.
And if you like it, share it. Maybe your friend will get
Yeah.
something out of it too. Thanks.
Bye.
Be well.